Good day, everyone. I want to wish you the warmest of welcomes to our webinar today, which is hosted by the Academy of Science of South Africa, or ASAF, as we more fondly know it. My name is Angela Matthey. I'm from the South African Medical Research Council, and I will serve as the facilitator today. Our topic today, as you know, is One Health in Africa, recognizing the environmental role. And our topic has been prompted by a report issued by the European region of the World Health Organization a couple of years ago, in which they emphasized that the One Health triad of environmental health, human health, and animal health, within that triad, the environment is relatively neglected. Up to now, the predominant focus has been on communicable diseases, on zoonotic diseases, and on antimicrobial resistance. And of course, attention on those important dimensions is completely justified, since 60% of our known diseases emanate from animal reservoirs. And in the last 30 years, 70% of new diseases have also derived from animal reservoirs. And that includes the hantavirus, the West Nile virus, Zika, SARS, including COVID-19, the pandemic of recent years, Lyme disease, and then, of course, in the last few days, Mpox has been declared by the World Health Organization as a public health emergency of international concern. And then we have less attention paid to diseases like tanopox, which used to be confined to the equatorial region of Africa, but is now spread to southern and south Africa. And one of the reasons why a focus on the environment is so important, or increasing our attention to the environment in One Health is so important, is because of the extent of environmental degradation that we see. Changes prompted by changes in land use, in agriculture, forestry, and in urbanization, especially rapid urbanization. Then there's also increasing concern about climate change, and one of our speakers will focus on that today. There's the growing global population and how that affects density, including the formation of vast squatter settlements across Africa. We are very concerned about biodiversity loss and what that means for human and animal health. There is enormous concern about the prophylactic use of antibiotics in the livestock industry. And then there's also a pollution of the environment, of soil, air, and water, and that's been a focus in the World Health Organization repeatedly over many decades. And then also we've seen the Lancet Commission on Pollution and Health and others paying attention to this important issue. So it's imperative that we also extend our focus to the environmental dimension of One Health. And one of the big reasons for that is that the environment is the common factor between animal health and human health. And it's been described as the substrate and the mediator between the two. And how we as humans manage that environment can determine whether the impacts are positive or negative. So we have three speakers today to focus on the environmental role in One Health. The first will be Dr. Alexandra Caron, and then we'll have Professor Cara de Wright focusing on climate change, and then environmental exposures in One Health will be the focus of Dr. Busisiwe Shezi's presentation. They will each have 20 minutes for their addresses, and then that will be followed by an additional 20 minutes for questions and answers. So please, you're invited as they emerge to post your comments and your questions in the chat, and we'll get to as many of them as we can in the Q&A session. At this point, without further ado, I would like to invite our first speaker, Dr. Alexandre Caron, to share his presentation. Dr. Caron is from the French Agricultural Research Center for International Development, and he has spent many years working in Mozambique and other Southern African countries, and we invite him to share his perspectives with us now. Thank you very much.
Thank you. Can you hear me? Can you see my screen?
Yes, to both.
Perfect. Okay, thank you very much for the invitation to present on the contextualization of environmental and ecosystem health in the One Health concept. I will apologize first because I'm just coming out from my holidays and had very little time to put everything together this morning. So I hope I haven't missed a big thing. But I want to tell you not a story, but I mean some of the ideas we've been brainstorming around through the COESA project. I will come back through this project. So I'm working for CIRAD, and since a couple of days I'm hosted by Hilary in Nairobi, Kenya. And so this project COESA is co-coordinated. I mean, it's coordinated by Hilary, but also by CIRAD and ISA. So the One Health concept has been blooming in the past 10, 15 years, with each organization, each project coming up with its own representation of this One Health concept. It has been called a boundary object, basically something that everybody understands, but nobody can provide a proper definition of it. But as a professor said, it's usually represented as a three-component concept, which looks very simple, but in fact hides quite a complexity inside it. So if we look at this representation, you usually have the human health component, which deal with individual health, human population health. And as you know, through the WHO definition of health, it's not only about diseases, but it's also about well-being and mental health. Then you have usually the animal health component, which deals with the health of production animals, of pets. Wildlife should be there, but it's not always in this component. And there are question marks about the health of production systems as well that deal with animal production systems. And finally, you have this third component that is sometimes called environmental health component or ecosystem health. In our team, we like to call it the social ecological system health component. Sometimes it's simply called the wildlife health component. Well, as it has been said, it's really the component that is usually not very well defined. It's always there, but usually everyone is left to guess what it's all about. So that's important because it's one of the three pillars, and so far it has not well been addressed, and therefore in One Health platforms at country level, it's usually very badly represented. Then also in the last years, some other specialists came to say, but what about wild plant health? What about crop health? What about soil health? You know that more than 66% of biodiversity is in soil. We know that now. And so what about that part of biodiversity, and what about its health? And it's true that currently, I mean, up to very recently, this was not clearly represented in the One Health framework. So luckily, a couple of years ago, the quadripartite and the One Health high-level expert panel came up with this new representation of the One Health concept. I'm sure you know about it. On the left-hand side, it's basically say that it needs intersectoriality between the human sector, the animal sector, and the environment sector. This intersectoriality and interdisciplinarity at research level needs to be implemented on the right-hand side at a society-wide scale, from the local to the national to the regional, to the global, without forgetting some key components such as inclusivity, equity, and access. And how do you achieve this intersectoriality? It's through communication, collaboration, coordination, and capacity building. And through those efforts, you should deliver One Health, which is healthy humans, healthy animals living in healthy ecosystems. So clearly, this new definition offers us a broader perspective on One Health, and it provided us within the COISA project with food for thought, basically. So the COISA project quickly is capacitating One Health in Eastern and Southern Africa. It's funded by EU. There are 3 consortium leaders, as I said, and it operates in 12 countries in Eastern and Southern Africa. South Africa is not included, but University of Pretoria is one of our key stakeholders. And through universities and working with One Health platforms in countries, we try to promote knowledge sharing, governance, education, and research. And this is what we say, with what we define as trying to institutionalize One Health in countries. And then the last part of the project is about operationalizing One Health in the country, delivering One Health solution. So within the framework of this project, we decided to say, okay, what about this the third component of One Health? So at the beginning of the year, we organized a workshop in Zimbabwe in the Hwange ecosystem on integrating environment and ecosystem health and its practitioner in One Health. So we had 3 days workshop. During 1 day and a half, we had presentation with invited guests. So I'm just going to give you some example, but I will give you the link to follow those presentation on YouTube if you want. So Salome Bukachi from Kenya and from OLEP came back on that definition of health that is not just about disease, but also about mental health. We had also the perspective about health, people, animal, and the environment from the local communities, the Nambia community. What are their own representation of the concept of health in the different compartments? We had also the perspective of one of the quadripartite members, the World Organization for Animal Health. Some presentation about the Libreville Declaration. I'm just mentioning it because most countries in Africa are signatory of this declaration, but it's only Botswana who has followed the lead. And it's very interesting to provide some linkages between environmental health and human health. And of course, climate change. I won't talk about it much because there is a presentation about this just after me. Then we had other session looking at more classical public health and environment topics, waste management, infectious disease, public health, and environmental health. And a very interesting last talk about how foot and mouth disease is a perfect One Health example in Southern Africa, even if it's not a zoonosis. And that is also one of the particularity of Southern Africa, and I think it's important to highlight it. And also a session on other type of other components that are not yet integrated into the concept, soil health, health, forage, and feed. We had also an interesting and challenging presentation about water health from the International Water Management Institute. And finally, a last session about ecosystem health, looking at rangeland health and the herding for health concept, social ecological system health, and rangeland management and health in pastoral communities in Eastern Africa. So through this 1 day and a half presentation, we had quite a broad view of some, it's probably not exhaustive, but some of the disciplines, the field that can be involved in that third component of One Health. And you have the YouTube link here to look at all of these presentations. I strongly recommend for you to look at them. And then we had a day and a half of field visit in a very interesting Wang ecosystem at the interface between the national park and the communities, and some brainstorming group work. And we came up with 5 main observations. The first one is that there is a broad breadth of fields involved in that environmental health or ecosystem health component. I've just provided, I mean, those presentations just give you an idea of the range of disciplines that are involved in that, potentially involved in that third component. Then, of course, if you have such disciplines, you have a number of and a diversity of stakeholders that needs to be involved, which is very large, and in fact, much larger than in the animal health sector or the human health sector. And these has very important consequences in terms of managing One Health at national level, for example. The third observation is that there is room for quiproquo because all these different professionals have their own vocabulary, their own world vision. And so they need to talk and understand each other and share a common vocabulary. A very good example is that if you talk about within the public health sector, environmental health is the impact of the environment on human health. If you talk to practitioners within the ecosystem health sector, then environmental health means the health of the environment. And we had some colleagues arguing for each of these definitions during the workshop and really pointing at the fact that we really need to talk to each other and come up with a common vocabulary. The fourth observation is that when you start talking about ecosystem level or social ecological system level, then you really start to address complexity and wicked problems. And so this is something that myself, as trained as a veterinarian, I was not trained to deal with. I'm sure it's the same from the human health sector. But here, when we talk about ecosystem health, linked to wildlife health, linked to animal health, human health, it's much more complex. And we tried in the paper I indicate here to try to showcase how the health of social ecological systems can be dealt with, also looking at the health in social ecological system, which is the health of humans, of animals, of wildlife, of plants, etc. I will not get into the details of that scheme, but just to show complexity and so the need for interdisciplinarity. And interdisciplinarity is difficult because we are not, I mean, at least us, a former generation, we're not trained for interdisciplinarity. And the last observation, just taking the time, the last observation is about how do you operationalize One Health to benefit the health of local people, local community, their animals, and their environment. And so it raises the question of community-based One Health, and therefore this really linked to transdisciplinarity issues, meaning that you don't do things only in between experts, but you also bring in and put at the center the final beneficiaries of your intervention. This means to invest a lot in participatory sciences, participatory methods in order to co-design intervention using local culture, local knowledge, to empower people in order to implement this intervention and co-monitor, etc., etc. And through the ProSuli project that I indicate here, I the smaller link also if you want to know more about that project, we try to come up with a methodology in order to have a proper bottom-up I would say a bottom-up process of intervention in order to start coming up with a community-based One Health approach. So from these 5 observations, I will try to come up with some implications for One Health institutionalization and operationalization. So institutionalization is about developing at national and different administrative levels the infrastructure of One Health in order to be able to operationalize One Health properly. So at the end of our workshop, we tried to come up not with a new One Health framework, but a framework in order to help us to articulate some concepts that we discussed. So if we take a kind of social ecological system approach with societies at the interface with the environment, then you have in the domain of public health, you have what is called environmental exposure that can have an impact on human health and domestic animal health. And you can see that human health and domestic animal health are divided between the biomedical, the disease aspect, and the well-being and welfare aspect for animals. These environmental exposure is in fact what is called environmental health by the public health sector as the impact of the environment on human health. Then human activities and agricultural activities and other type of human activities have an impact on the environment, what we call environmental outcomes. For example, an impact on of wildlife health, a disease like bovine tuberculosis spreading from domestic animals to wildlife population. And this is environmental health as the health of the environment. And this is through, the definition by practitioner of ecosystem health or social ecological system health. And then those negative impact on the environment, on biodiversity, on ecosystem, then induce an environmental degradation that increase the environmental exposure and with a negative feedback loop represented by those red arrows. What we try to do in the past years is try to promote environmental regeneration as a broad definition in order to have less environmental exposure. Making the assumption that protecting the environment will decrease the negative environmental exposure of human and domestic animals, and therefore those activities will have potentially a positive feedback to the environmental component. So, that's where we are in terms of brainstorming. I don't want to go deeper in that, but I just want to go to a couple of other slides in terms of consequences, in terms of implementation. In terms of One Health institutionalization, clearly that's new definition by OLEP of the One Health platform means that the current existing One Health platform need to be broadened extensively in terms of the type of stakeholders that are represented. So through COESA in the 12 countries, we've asked the governments involved where there is a One Health platform, or even in countries where there is not yet a One Health platform, to develop a strategy document to engage new stakeholders from the environment and ecosystem health sector. Which means that it will be harder in countries like Kenya or Rwanda, who have had a One Health platform for 10 or 15 years, because they have a functioning One Health platform, and suddenly they need to enlarge it quite a lot with new stakeholders. For countries that are just starting, like Botswana or Namibia, it's easier to start from scratch with a set of stakeholders. But basically, this strategy document is about identifying in country what are the key stakeholders that needs to be on board, to try to make sure that we motivate them and to come into the One Health platform, and so they have a will to come in, and also to convince the stakeholders that are already in the One Health platform that they need these new stakeholders to come in. So this is an important aspect that we are currently developing. And in terms of One Health operationalization, of course, you cannot do everything everywhere. So it's about context and problem-based. So in one ecosystem or social ecological system, you need to have, you need to identify, hopefully with local stakeholder, a problem, and then you try to address this problem. Currently, through different projects, we've been testing models of inter and transdisciplinarity. I mentioned the ProSuli project. There is one article on the left-hand side, but also I strongly recommend for you to look at the HEAL project, onehealth4heal.org, where they've, in pastoral communities, they have developed One Health unit that are supervised not only by a One Health task force, but also by a multi-stakeholder innovation platform where a final beneficiary, pastoralist, can say, this is the type of service that we want by this unit, and this is how we want it. So this phase is really starting now, and there are a few examples, but it's really an open field. I think I'm 20 minutes now, so I will stop here just to say that each region, each country needs to come up with its own One Health framework and operationalization, because it's not about a blueprint, it's about locally adapted solution. Thank you very much.
Thank you very much, Dr. Karan. That was a really thoughtful presentation. And we're going to shift now to a focus on climate change and One Health. So we call on Professor Cara D. Wright to share her slides and start her presentation. Professor Wright is with the South African Medical Research Council Environment and Health Research Unit. Over to you, Cara D.
Thank you very much, and good afternoon to everybody. I am just trying to work out how to share my screen. I've got two screens, so it will just take me one moment. I think I've got the right one. Share this one. And then I want to quickly put it into full screen mode, which is here, I think. View, full screen mode. Excellent. Are you able to see that?
Yes, we can.
Super, thank you. Thanks very much, everybody. So I'm going to take us back in time to a moment of history which I think most of us will recall quite well, although the memories might be fading a little bit now. At the time of the COVID-19 pandemic in South Africa, the population was just over 59 million. We had a total COVID-19 cases of just over 4 million, which was almost 7% of our total population. And there were more than 100,000 COVID-19 deaths. It had a really large impact on society, and many questions remain unanswered about where it came from and how it came about. But we know that three elements were critical in the development and the spread of the COVID-19 virus, the COVID-19 virus and the pandemic, SARS-CoV-2 virus: the environment, animals, and humans. And that's what I'd like to speak to today. A while ago, I worked on this report, the United Nations Environment Programme, Preventing the Next Pandemic, Zoonotic Diseases and How to Break the Chain of Transmission. The report speaks to how One Health can be used to describe what occurred in the COVID-19 pandemic. The diagram shows how pathogens originate in animals, and then there's potentially spillover of diseases that they cause is usually from human actions, for example, exploiting wildlife unsustainably, degrading or fragmenting ecosystems, or introducing wildlife into areas with human contact through wildlife trade. We need an intersectoral approach, such as One Health, to manage these challenges. Key messages from this UNEP report included that One Health is an optimal method for prevention and responding to zoonotic disease outbreaks and pandemics to achieve health for people, environments, and animals. And then we think about climate change, which is deemed to be one of the greatest threats to human health of this century. The next question is, does climate change, or did climate change affect the transmission of the SARS-CoV-2 virus? So we don't have direct evidence of this, but we do know that climate change alters how we relate to other species on Earth, and that matters to our health and our risks for infection. With global warming, as shown in the chart, as one of these causes, changes or drivers occurring because of climate change, animals move and interact with animals that they have not seen before, creating opportunities for pathogens to get into or onto new hosts. Many of the root causes of climate change also increase risks of pandemics. For example, deforestation, mostly for agricultural purposes, is the largest cause of habitat loss globally. Loss of habitat forces animals to migrate and potentially contact animals and humans, including, for example, as I mentioned, the wildlife trade as well as wild meat consumption. Climate change is therefore considered a disease driver. We want to take this a little bit further, and this figure, which is a little complicated, but I'm going to speak through it now, it shows the potential effect of climate change on bats. Now, we know that the bat is not the confirmed species. It's likely that the virus began in sort of its ancestral origin in the bat species, but reacted with humans through an intermediary species. For example, pangolins have been suggested. So here we are looking at the effects of climate change on bats and its habitat, and a possible correlation with the SARS-CoV-2 emergence. So many natural and anthropogenic interventions in the native habitat of bats had increased the probability of their contact with humans, making us more susceptible to SARS-CoV-2. The rise in industrialization-related human activities has created a marked imbalance in the homeostasis of environmental factors, such as temperature. So this was critical in the case of what's been shown here on the slide. There was potentially mutated specific genes affecting immunity as a result of high level of heat shock proteins, which usually protect against high temperatures and adverse environmental effects, which the bat was experiencing at the time. And this then affected things like special gut metabolites. And so climatic variations and anthropogenic factors have resulted in increasing stress responses in bats that carry various coronaviruses. Such changes in bat physiology have helped in creating novel mutants capable of infecting humans. So moving to what we've already heard from the previous presenter, environmental health. In the world that we work in, which is public health, we relate this to how the environment impacts our health. What are the risk factors that may influence human health and well-being? And people are exposed to these environmental risk factors in their homes, in their places of work or occupation, and in the environments and communities through several pathways. For example, this World Health Organization diagram is illustrating a number of environmental risks: air pollution, inadequate water and sanitation, chemicals such as pesticides, radiation, community noise. We often don't think of noise as an environmental threat. Occupational risks, agricultural practices, there again mentioning pesticide use, as well as wastewater reuse, which if not done correctly can be a risk. Built environment, for example, dwelling characteristics that are not conducive to healthy living environments. And then the last one, but certainly not least, is climate change and all of the drivers that are potentially affecting our health and well-being. So the people who are responsible for managing environmental health at a community level in all countries around the world are environmental health professionals or practitioners. They are tasked to track and surveil and monitor and implement prevention measures to ensure that environmental health conditions are optimal for the good health and well-being of communities and societies and countries at large. In South Africa, our EHPs, environmental health practitioners, have a scope of practice calling for, among other things, the management of zoonoses, such as rabies and schistosomiasis, ensuring safe water and air for communities, food safety, how one deals with people who have passed away, border control, and many other aspects that relate to environmental health. The EHPs have been applying One Health principles in all that they do since time began, when environmental health came as a field came into practice. They're constantly considering what is the state of the environment, how is this affecting people? And then, of course, they're also thinking about things like rabies, as I've mentioned. They practice prevention is better than cure every single day that they go about doing their work. So during the COVID-19 pandemic on the 16th of March 2020, our government published COVID-19 environmental health guidelines for environmental health services to keep the environment clean and try and prevent transmission through safe hygiene practices. Now, implementing these guidelines was a challenge. As we know, for most policies or guidelines that come out, we're not always well resourced or don't necessarily have the capacity to go about fully implementing the guideline. But what the guideline did was really focus on this philosophy of prevention and understand that there were new challenges arising because we were bringing together so many different fields in the COVID pandemic. We had to think about the pathology, the microbiology, as well as the environmental science, and then, of course, thinking at the other end of the spectrum in terms of the clinical things like treatment and cure. And so this was a multiple range of essentially One Health stakeholders coming together to the drawing board to really think of the best way to curb the transmission of SARS-CoV-2. But there were definitely successes in the story. There was a really good adoption of the benefits of and adoption and realization that there were benefits of applying a One Health approach, bringing together essentially multiple stakeholders from the different government departments to sit together, potentially, I suppose, in like a war room environment, to make sure that all different aspects were considered to try and resolve the pandemic crisis. So in this case here, we really know that environment is at the core of One Health, sitting, of course, bringing together humans and animals, but really the environment, if it's not protected and conserved, can be the space where many things start to go wrong. The World Bank, here, this figure from the World Bank, makes a compelling case for integrated human, environmental, and animal surveillance, emphasizing that if you look at the beginning of the figure, and here we're looking at incidence and cost over time, if emerging diseases can already be detected in vectors, in wildlife, or in livestock, prior to their detection in humans, very large costs could be averted. And the estimation is that savings of between around 350 to 400 billion US dollars over the next 100 years are expected from the use of integrated surveillance of zoonoses with pandemic potential. Savings from early detection of pathogens in vectors would not only apply to vector-borne zoonoses, but also for vector-transmitted diseases like dengue fever. So essentially, we'd want to work towards where we don't see this cumulative cost of an outbreak and make sure that we eliminate at each stage, but starting at that stage of environments. And then I'd like to conclude by thanking the MRC for funding and the Academy for inviting me to speak today. Thank you.
Thanks very much, Cardi. Our speakers are being very efficient today and very respectful of the time allocation. So we're moving quite quickly. I would like to move straight away on to Dr. Busisiwe Shezi, who's also from the Environment and Health Research Unit at the South African Medical Research Council and has a lot of experience on environment and health issues at a local level. So Busi, if you're ready, can you please go ahead and share your slides? And we look forward to hearing what you have to say.
Thank you, Angie. Let me know when you can see my screen, please.
Yes, we can see it now.
Perfect. Good afternoon, everyone. So, as previously mentioned by other speakers, One Health recognizes that the health of people is closely connected to the health of animals, and our shared environment. My favorite slogan is, when we protect one, we protect all. As mentioned by Angela earlier, their focus has mainly been on zoonotic diseases, communicable diseases, as well as antimicrobial resistance. The non-communicable diseases that result from exposure to toxic substances has not been highlighted as much in One Health. So there is growing concern over the accumulation of toxic substances in the environment, as well as in the fatty tissues of animals. These then make their way to humans through the food pathway. And an example will be when we eat fish that is contaminated with heavy metals. So there are many environmental exposures, and these include pesticides and herbicides, metals such as lead, mercury, arsenic and cadmium, as well as air pollutants. And these are present in the air that we breathe, in our water, soil, food, as well as consumer products. So many activities can lead to elevated levels of these toxic substances in the environment. And these include burning fossil fuels and vehicle emissions, construction and demolition activities, mining activities, farming activities, and even the home-based industries. And examples of home-based industries are welding, spray painting, car repairs, and scrap metal recycling. So there are many studies that have been conducted in the African continent assessing the levels of these toxic substances on environmental samples as well as biological samples. And research conducted by the SAMRC has also found elevated levels of these toxic substances in both environmental and biological samples. And in some instances, these levels were above the safe limits provided by the World Health Organization. And we found that communities that live closer to sources of pollution, such as mining and smelting operations, are at increased risk. So exposure can occur through many ways, including the inhalation of dust particles, consumption of contaminated crops, meat or seafood, drinking contaminated water, and children, women, pregnant women, and the elderly are at increased risk because they are vulnerable. But just an example on children, their bodies are still developing. So exposure even to very low levels can result in adverse health problems. So many health outcomes have been reported, but people may experience symptoms such as tiredness or weakness, muscle or joint pain, headaches or stomach cramps. Studies also report cognitive and social impacts, such as reduction in IQ scores, as you can see in the study here. But studies also report higher levels of aggression, violence, and criminal behavior. And how that happens is that when these toxic substances enter our bodies, they can interfere with the neurotransmitters in our bodies, which then result into these cognitive and social impacts. And then there's also research showing that they can damage the brain, kidneys, heart, nerves, blood cells, and in very high levels, they can cause paralysis, coma, and even death. So there's also emerging evidence showing that these toxic substances can result in mental health problems. If I can make an example with particulate matter, when you are exposed to fine particles, they can enter the body and then they travel to the brain via the bloodstream. when they get into the brain, they can alter the blood-brain barrier in the brain, which protects the brain from harmful substances. And then what happens after that, these toxic substances, they can alter the brain regions that control emotion, such as the hippocampus, can also result in the inflammation of the brain, as well as an increase in the stress hormone. This then results in mental health problems such as depression, anxiety, suicide, as well as bipolar, and many other health problems. So this is just an example of how the environment can impact our health. This is a lead and zinc mine in Zambia. It was opened in 1925, and years later it was linked to lead pollution. Tens of thousands of children and women of childbearing age were poisoned by lead dust. Even though this mine was shut down in 1994, recent studies still report elevated levels of these toxic substances because they are persistent in nature, so they can be present in the environment for a very long time. So moving on to the environment and animals, again, many studies conducted in many African countries such as Tanzania and Nigeria have assessed animal samples taken from different animals such as fish, chicken, and those samples were assessed for various toxic substances. And they reported elevated levels of these toxic substances, and in some instances also exceeding the safe limits provided by the World Health Organization. This is here in South Africa in KwaZulu-Natal, an area called St. Lucia. They assessed lead exposure in crocodiles, and they reported that high blood lead levels in crocodiles were linked to poor tooth condition and other health issues. And we can see that all these examples, these are at the top of our food chain. So, when animals are exposed, then humans will be exposed by eating these animal products. The way in which animals can be exposed can be through ingesting these toxic substances through contaminated feed, soil, plants, as well as through drinking contaminated water. So just before I conclude, this example, it just shows the link between the environment, animals, as well as humans. So it's an incident that happened in Japan in an area called Minamata Bay in the 1950s. So they experienced a severe outbreak of mercury poisoning, which was caused by industrial waste that was discharged into the bay. Fish and shellfish became highly contaminated, and people that consumed this contaminated seafood developed symptoms of neurological disorders, including numbness and difficulty walking. And over 200 people died. So this is just a good example of how connected humans, animals, and the environment are. But it also highlights the importance of highlighting environmental health more in One Health, as well as the non-communicable diseases that result from exposure to these toxic substances. That is the end of my presentation. Thank you. Over
Thanks.
to you, Angie.
Thanks, Busi. And really thanks very much to all of our three speakers. I think it really came through very powerfully across the three presentations that the environment, even though it's currently relatively neglected, is really the starting point, and that common substrate that affects animal health and human health, and that it does deserve the additional attention that the WHO European Regions Report called for. I'm trying to see if we have any questions on the chat. Kutso, do you see anything yet?
No questions as yet, but people are allowed can put up their hands and then I can enable them to speak.
Yes, please do go ahead and raise your hands, and Kutso will facilitate that. But to get us started, I would like to ask Dr. Karan, you know, you emphasized it through your presentation, this balance between, to me, it seems like a balance between complexity and generalization on the one hand, and reductionism or specialization on the other hand, and that we need to hold both of those dimensions. And in your work, I'm wondering how you perceive that, and if you have any responses and suggestions for all of us who are grappling with the complexity of One Health.
Yes, thank you for your question. You're right. If you look at if you think about the One Health concept in its new definition from a conceptual point of view or theoretical point of view, it's very broad, and basically it almost includes everything. If you really want to, if you take an ecosystem or social ecological system and you try to address One Health holistically in that system, you will need basically everyone. So that's the theory, and that's complex. But in fact, when you get to the ground and you arrive with one problem to be solved, or if you we're doing more and more that if you go to, for example, communities close to protected areas around Kruger or around Bonareju in Zimbabwe or Limpopo in Mozambique, and you say, okay, what are your problems? And they identify a problem. Can be a health-related problem. It could be a non-health related problem, but you try to address that problem. And then by discussing, by interacting, you identify the different sectors that should be involved to address that problem. And by addressing that problem, you also need to foresee what could be the negative, if you're successful, what could be the negative outcomes to other sectors. And that's why an holistic approach to that is important. So that's why in my last slide, I mentioned about problem-based. If you have a problem in mind, then it's not like about everybody, but you can identify the stakeholder that you will need to address that problem. Thank you.
All right. Yeah, thanks very much. I mean, I really do appreciate that in your presentation, I found that you gave a really clear roadmap for action for countries on One Health. Busi, I was wondering, thank you for mentioning those two very important and severe incidents of environmental contamination, both the Minamata Bay incident and the Kabwe incident. And there we see extreme cases of environmental contamination and how it affected both humans, children who were severely debilitated by lead poisoning in Kabwe, for example, and how the studies there have also shown extremely high levels of lead in the blood of domestic animals and of wildlife. And I'm wondering if you have any comments or thoughts on how some of these incidents, once the environmental contamination occurs, especially at such gross levels, the impacts for both human and animals endure over many, many decades. And I wonder if you have any thoughts on that. I think several of the presentations spoke to the power of a One Health approach to prevent ill health. And I'm wondering if you have any thoughts or experience on that notion, the power of One Health for prevention, which we know is the cost-effective way to go.
Thank you, Angie, for that question. So there are methods that have been applied, which can be very expensive, which involve removing these toxic substances from the environment. And that includes, for example, washing of soil and other methods. So yes, there are things that can be done, but obviously it can be expensive to do.
All right. Okay. Thanks for your response, Apusi. And then Karadi, I have a question for you next. I mean, I listened to your presentation almost with a sense of dismay because, as Dr. Karan said, the issue of One Health is so extremely complex, and then overlaid on, on top of that, we have the climate change issue to grapple with, just making everything more complex and escalating the problem. And I was just wondering how you view that, having steeped your career in climate change, how you view that relationship between climate change and One Health.
Thanks, Angela. So I think that the two concepts are well suited to each other because they're what you could call wicked problems, and they require this sort of multi-systemic approach to understanding them. When you think of One Health and there's just these three core circles, each of those is infused with multiple other factors that are, the challenges and make things more difficult, risks and threats and drivers specific to either animals, humans, or environment. Now you're trying to bring it all together. So you have to apply multi-systemic thinking. And that's the same kind of thing that we are thinking about with climate change. Because particularly when work that we're doing in adaptation and intervention, you can't solve a climate change and health related problem with a one type of lens approach. You need multiple lenses looking at the problem from different angles, different perspectives. And in the same way as the One Health approach, it leads you to thinking in this multi-systemic way, especially if you're wanting to improve resilience and adaptive capacity, which is essentially what we're looking for in the climate change space. Whereas in the One Health space, I think we really are very much more focused on prevention. And we know we can't really adapt to a pandemic, for example. Yeah.
All right. Thanks, Karadi. Busi, I see there's a question for you in the Q&A section. The question is under the health outcome of hazards in our environment. Are there current measures the SAMRC is embarking on to ameliorate the effects in South Africa, especially in areas with high, I think, toxic effects from our environment? I think you kind of addressed this question in response to my question on cubware, but do you have anything else to add?
Thank you, Angie. So within the SAMRC, we do focus on research translation, for example, where we educate communities about these exposures and how they can protect themselves. So that's one of the things that we do in order to ensure that communities are, are protected. But one major thing that we also try to do is, because we've noticed that some of these communities live very close to sources of pollution, at times even within 100 meters. So the research that we do, we hope that we can enforce maybe legislations or policies related to maybe having buffer zones between sources of pollution and human settlements in South Africa.
All right. So it is, it relates to what Dr. Karen mentioned earlier on, local solutions to local problems. And Dr. Karen, if I can come, I see Sizwe Nkambule has his hand up. Sizwe, please go ahead.
Thank you, Angela. I just want to say thank you to all the presenters. My question is actually to all three, and I know probably we could go on about this for the whole day, but given the issues that we've highlighted today about how One Health issues can result in pandemic outbreaks, I just wanted to know from the speakers, in their opinion, what would a surveillance or public health surveillance or monitoring approach with framing a One Health system look like in an African setting? Thank you.
Thanks, Sizwe. Is there anyone who would like to take a first step at answering Sizwe's question? Surveillance for One Health.
Well, I can. Oh, okay, go for it.
Go ahead, Alex. It's a complicated question.
Well, it's an important it's obviously an important question about prevention. I will answer the way I usually talk about that. I think prevention, as Caroline mentioned, is meaning surveying wildlife in their habitat and trying to understand what is the interface between wildlife and livestock or wildlife and humans that can indicate transmission pathways between wild animals and domestic animals and humans is a way to prevent the risk of pandemics. If we had some a good surveillance in that market in China, wet market in China, we could have detected earlier on the spillover. If we had some researcher in those caves where those bats are in China, we could have detected earlier. And this is important, and we are doing some work on bats, and so I'm not saying it's not important. This is important, but in fact, if we really want to prevent the root causes of pandemic, as Professor Wright mentioned, I mean, it's about stopping the degradation of the environment, of ecosystems, trying always to increase the interface between people and wild animals that usually should not be in contact with humans, etc. So I'm coming back to the graph we presented. It's really about feedback loop. So environmental health for public health is about the exposure of human health to the environment. But if you don't care for this environment, then you will increase the exposure. So the relationship between surveillance and pandemic is also a relationship between taking care of the environment and pandemics. Thank you.
Thanks very much. Before I go on to the next question, Sizwe, I wonder if you would take a moment. I know you're very involved in wastewater surveillance, which is a really cost-efficient way of conducting environmental surveillance in a catchment area. And I wonder if you would say, just very quickly, what your thoughts are on the value of wastewater surveillance in One Health.
Thanks for the question, Angie. I think, in my opinion, it would be more broader of perspective of environmental surveillance. Obviously, wastewater being one of those mediums that we would investigate, but what we see in a South African context where we have challenges when it comes to water supply systems already as it is presenting an acute health risk due to the presence of different bacteria and water in the water supplies. And then you add on top of that the dysfunctional state of a lot of our wastewater treatment plants that results in a lot of wastewater simply being flushed back into the environment without any treatment. From a wastewater surveillance perspective, if we adopt that kind of approach, it would give us more insight to the potential threats that community members may face within a particular wastewater catchment. And again, it would also allow us on the other side to monitor from a community health perspective what might be the circulating pathogens or viruses that community members might have been infected with as a result of the various poor hygiene and water and sanitation issues here in South Africa.
Yeah, I mean, I completely agree. I think it is a powerful tool cost effective. You take one sample and you get an indication for an entire community, and it can measure environmental quality, lead contamination, and it gives an indication of human health. And I'm sure it can be extended more effectively to animal health as well. So thanks very much, Sizwe. I'm now going to ask Kolisi to please pose his question. Kolisi, can you unmute and ask your question, please? Okay, if you're having trouble unmuting, could you write your question in the Q&A? He says his microphone is not working. You'll write it down. Okay, please. So while we are waiting for you to do that, Dr. Karan already mentioned the issue of a wicked problem in relation to climate change. But in Africa, specifically, we have other wicked problems as well, including poverty, inequality, and low capacity to adapt to some of these challenges. And I saw in your slides you were giving, you indicated local projects, and I wondered if you have given any thought to how poverty can affect our capacity to deal with some of these problems in a One Health framework.
Well, that's a difficult one. Thank you. Well, we don't look at how poverty affects. We take the problem the other way around. In fact, we work with poor communities. Usually, we work with poor communities that live at the interface with protected areas, so it's in specific context. So they are poor communities, and we try to improve their livelihoods. So when we say we try to improve their livelihoods, it's equivalent of saying we try to improve their well-being, basically. So it's about their health, but not only about disease, but about their well-being in general.
Mm.
So basically, we try to address poverty to some extent. So trying to promote agricultural production that is feasible and productive in a semi-arid context, in the face of human-wildlife conflicts, for example, and those kind of things. We address animal production health issues related to disease of livestock, tick-borne diseases, but the end, our end objective is really is poverty, because poverty is directly linked to health. So we don't see poverty as a driver, but it's kind of an objective to reduce poverty. Thank you. I don't know if I answered properly, but
no, it is a wicked problem, hard for anyone to come up with an answer to that. But thanks very much. We have a question from Anya Terlo. I'm not sure who the question is addressed to, but the question goes similar to the questions by Esla. Are there any large-scale, long-term, population-based examples of environmental resilience, such as agroecology, permaculture, nature-based solution, ecological regeneration type comparative intervention studies that have demonstrated a substantive impact on key human health indicators on those populations, rather than focusing on the more direct indicators, for example, food production and food production outcomes? Oh, so I think it's this dilemma of reductionism versus complexity or generalism. Again, I certainly don't know. I'm sure there are, and I'm wondering if any of our speakers know of such studies. I see Cardi is responding. But
No, Angela, I mean, I've just taken on a really big sorry, I jumped in there.
go ahead.
I've taken on a very big task as part of my National Institutes of Health work as a climate and health scholar to try and understand essentially whether when we are putting together interventions, are we planning to assess the effectiveness of those, which goes beyond those either direct or indirect impacts that we're aiming for, more nuanced indicators to assess effectiveness. And certainly in the space, so I don't know about the environment, but in the space of human health, well-being, and climate change impacts, there's nothing like that. And that's a scoping review that I'll submit quite soon with a potential framework for doing it. So I think that we are thinking along those lines, which is really good, as we are going to need those more and more in the future.
Yeah, I do think, the complexity issues will really be challenging to overcome. And the issue simply of intersectoral action is something that we've been grappling with for decades and not often succeeded with it. So I think the answer to the question is no at this stage. There's another question from an anonymous attendee. Thank you for your excellent presentation. They are thought-provoking. Question to all the presenters: as an organization that advocates for children's environmental health, how can we go about introducing the One Health principle in our work, especially on research interventions, action translation, and community-led programs? I think Dr. Karan gave some indication of that. But do any of the three of you have some suggestions for the anonymous attendee?
Well, I don't have answers, but within the COISA project, we're working the work package 3 is about education and capacity building, and in some countries, we are trying to, the stakeholders of the country, so through universities, are trying to develop some modules, how to include in curriculum for primary and secondary education some aspects or some concept of One Health. Maybe not talking about One Health because we don't want them to understand the complexity of the One Health, but to try to get them to understand the linkages between the environment, the people, the animals, and the health and well-being of each of these three components. So it exists, but it's clearly a new field that is. I don't know in South Africa if there is anything like that, but maybe I cannot say.
Yeah, I think there are examples which we don't often think of as a One Health example, but I'm thinking of there was a waste management project in Johannesburg some years ago where we tried to reduce the use of toxic pesticides in communities, and we conducted education programs and instead tried to introduce owls into the community. And so that, I think, is an example of, on a small scale, of a One Health project. And we had some challenges, unanticipated challenges with that project, but it was a good start. And I think, it's also about changing our paradigms, thinking about the work that we do a little differently. I don't see any other hands or any other questions at this point. So I thought what I would do, here another one has just popped up from Gabriel. I would like to understand how you measure the impact of One Health initiatives on Africa. What frameworks are being developed to monitor this impact? In my personal opinion, it is at this stage mostly project-based. But let me put the question to the the three speakers. I don't know of a monitoring framework that covers more broadly the concept of One Health. Are there any views from any of the three speakers?
Yeah, Angela. So again, this is an emerging area because we are still figuring out what we should be doing. And I think the pandemic definitely has pushed us in that direction now that we are doing, trying to do more to prevent future pandemics using One Health principles. So the European Centre for Disease Prevention and Control, they have a One Health framework. I'll put the link to the document into the chat. That's the one that I'm aware of. I don't think there are many others. I think it's usually, as Angela was saying, project-based, because One Health is so broad. It's the same in climate change and health. It's so broad. You have to have sort of a generic framework and then let people tailor it to their individual needs. You know, you can imagine, and I speak from a climate change health perspective, if I'm doing a heat health early warning system versus a malaria early warning system, even then the framework that you would want to apply and the different indicators will be different to, say, a behavioral campaign around the need for wash during drought conditions, which are exacerbated in a changing climate. So yeah, I'll put this in the link, and yeah, I think the FAO may have one as well. I'll have a look for that and put that in the chat as well.
All right, thanks very much, Corradi.
I'm going to copy and paste in the chat as well a recent paper by the OLEP with a review of all the existing tools about One Health. And please have a look at this journal. It's called CABI One Health Journal. There is a lot of interesting publication in that.
All right, thanks. Thanks to you both for that. I see no further questions on the Q&A, and I see no further hands. So I think at this point, maybe I will just try and list some of the points that I have found particularly interesting and helpful from across the three presenters. The first is conversations. I think that implicit in the three presentations was the need to talk and to have conversations as a starting point about One Health, especially across sectors or even across disciplines, so that we can, as Alexandra said, develop a common vocabulary and develop common or identify common interests. The second one is, hopefully those conversations across sectors will lead to kinds of national or local platforms that we see developing in the Cohesa initiative, which is so interesting. I think just trying to bridge the gap between the complexity and the generalism versus the specialization, it seems to me a useful thing or a useful approach is to start small and evaluate those local projects, thinking the old slogan, think globally and act locally. And I'm also reminded when I think of starting local projects, I'm reminded of the old African proverb that even an elephant, and that is what One Health feels like often, even an elephant has to be eaten one bite at a time. And one of those bites could be for researchers in health and in animal welfare and in environments to try and find every opportunity possible to add on one, if not both, of the other dimensions. So from the Kabwe example that you spoke about, Busi, it was so informative to see the scientists there look at environmental measures of lead poisoning, look at human exposures, and then include a wide range of animals in their studies as well. And for me, certainly, I would like to go forward doing that wherever it's possible. to try and include at least one of the other dimensions in our epidemiological studies, providing information on at least 2 dimensions, I think will be helpful in bridging those divides and also correlating exposures in humans and in animals. Another issue I found helpful, I think all 3 of the speakers alluded to it, is the issue of One Health as a vehicle for the prevention of disease, so that or the prevention of contamination and the prevention of pollution and intoxication, so that we don't have issues like Minamata Bay and Kabwe and those are 2 extreme examples, but many other examples of contamination and consequent ill health for both humans and animals. It also struck me that we need to be courageous, or we need to be exploratory or experimental. We need to try, we need to monitor, we need to evaluate the impact. And I like Dr. Karan's view of, they're not only looking at disease, they're also looking at well-being. So what are the positive issues that we can look at, how health can be created when we look at all 3 of the dimensions of One Health. I think those are the main takeaway points. My point we have already put to Dr. Karan, which is this wicked problems of climate change and poverty and the poor adaptive capacity, and the many incidents of extreme environmental pollution, which justifies entirely the topic of this webinar, which is the need to shine a light on that environmental dimension as much as we are on diseases or on zoonotic diseases and on antimicrobial resistance. Let me just take a look at the chat and see if there are any more questions. We've answered. Yeah, I think we've answered all of them. And I think if we have no further questions, then I am going to, at this point, thank all our, well, let me give the opportunity to the 3 speakers to see if you have anything further to add at this point. Any more thoughts from your reflections over the course of this webinar? And I'll start with you, Busi. You're still muted, I think.
Can you hear me?
Yes.
Can you hear me? Oh,
Yes,
yeah.
I can.
I was just saying thank you everyone for joining, and I'm glad we had this webinar today. Last year we had a similar webinar on One Health and environmental exposures, it was a seminar in Pretoria. So we're still writing a commentary on that, and hopefully it will be published soon, and people can have a look on, the outcomes of that seminar.
Yes, that will be great, Busi. I look forward to seeing that one. Karidi, any final thoughts from you?
I think Karidi left.
As she left, all right.
Yeah.
Then Alexandra, the last word from you.
So thank you very much for the opportunity to present and this interesting discussion. It was very interesting, and yes, and I hope we'll have more discussion in the future. Thank you very much.
Thanks, Dr. Karan, and thanks to all 3 of the speakers. I really felt like their presentations gave me some kind of roadmap to grapple with One Health issues in the communities in which I work. And then finally, I would like to thank everyone who joined today in our webinar. And then, of course, the final thanks goes to the secretariats and to ASAF for organizing and hosting this webinar. Thanks very much, everyone, for your time today.